All right, so the last part of our presentation time today together, we wanted to talk a little bit about, once we've made it this far in our project, planning for sustainability and spread, so that all this great hard work that we've done doesn't get lost and that we get to share it with others. So we'll start off talking a little bit about sustainability. Next slide. So we'll quickly go through some of the common sustainability mistakes, and we'll talk about how to plan for sustainability for your project. We'll walk through what I think is a pretty fantastic tool, the NHS Sustainability Planner, that can help you answer some questions about your project and inform areas where you may want to pay some attention to around sustainability. We'll share an example and discussion about next steps for sustainability and introduce HQO's spread planner, because we know once we sustain, we also want to spread these learnings and share them with others. And finally, some opportunities to share your work and stay connected with E-QIP and to really communicate out all this hard work, meaningful work that you've done. Next slide. So we're really tackling that final block in the model for improvement. Once we've tested, done our PDSA cycles, we have some data by way of our run charts telling us that the changes that we've made have not only been changes, but have actually been improvements. We of course want to sustain those improvements, not let things slide back to the way they were, but we also want to spread them and share them with perhaps other programs, other locations, others in our agency or our community or the wider sector. Next slide. So two typical frustrations, and if you're anything like me, maybe you've been pulling your hair out at these frustrations in the past. One is the improvement evaporation effect, and so that speaks to lack of sustainability, and that's, we have a great improvement, something's going really well for a while, and then time goes by and that improvement evaporates. Maybe the team leader or key person who was part of that improvement leaves the agency. Maybe something changes, or we just forget about it and assume that it's still going along tickety-boo, but sometimes it doesn't, and that speaks to the improvement evaporation effect. The other common frustration is the islands of improvement effect, and that's one that we've seen time and time again in our travels with E-QIP across the province. You'll see a project team or an agency that's done some really great work in one area. They've made a significant improvement, something really innovative, and then we'll visit other areas of the province and see teams that are struggling with that same problem. And folks don't always know about each other and the great work that they've done. That speaks to that island of improvement, not necessarily communicating the great stuff that we do, the innovations, the changes that we make. Next slide. So what is sustainability? So sustainability is all about holding the gains of our QI project over the long term. We want to make sure that we pay attention and things don't slide. And it seems that several or all of the following organizational priorities are important to sustaining quality improvement. The first is supportive management structure. Having those folks in positions of authority who are supportive of the work that quality improvement teams are doing and providing the resources and the time and the ability to do this work. Structures to error-proof change, and we'll talk about that, but trying to make it as easy as possible for folks to adopt a new change that we've made. So if we're changing a form, changing a system, trying to make it easy for folks to do the right thing and not revert back to old ways. I know Debbie speaks to, and I like the example, if you change it to a new form, get rid of all of the old ones, make sure they're all deleted. People can't use them for scrap paper, but the only copy that exists is the new one. Thirdly, having robust, transparent feedback systems so that we have some data to tell us how we're doing, how we're performing relative to that change, so people know that their change is an improvement and that those gains are being held. Having a shared sense of organizational systems to be improved, so that we're all on the same page about what it is we want to improve and why, what the benefits are of making improvement. Having a culture of improvement and deeply engaged staff. And this is really a critical piece. Not having, even within our agencies, islands of improvement, stuff that's maybe done at a leadership level, not engaging frontline staff, but rather engaging our frontline staff in that quality improvement process, and that it's part of the culture of what we do. We all want to improve for the benefit of our client service, and allowing staff to be an active part of that. And lastly, having formal capacity building programs, helping give people the tools that they need, both around quality improvement, but around any changes that we make. So if we, part of our change idea is that people use a new process or system, we need to make sure that we're educating them on that new process or system, not just expecting to flip a switch and people can do it tomorrow. Next slide. And so to be successful in sustaining our improvements, there's some key things that ideas strongly suggest. One is standardization of existing systems and processes for performing work activities. So the more that we can standardize a process or a system, the more likely our change ideas are going to be effective long term. Second is documentation of associated policies, procedures, and protocols and guidelines. Give folks the guidance, the information, the processes to follow to make it easier to follow something that has changed correctly. Not allowing for things like workarounds back to the old way, but allowing clear guidelines and procedures. Thirdly, measurement and review that the change becomes part of the routine practice. So not assuming just because we say it is so, it will be so, but measuring if we're changing something, and I know everybody here is highly familiar with that. If we're changing a process or PDSing a change process, making sure that we measure it to see that it does in fact become part of how we do business and how we operate in the future. And lastly, training and education for staff, as we mentioned. Next. And we spoke of this all the way through the E-QIP project curriculum, I think, but it's worth mentioning again here, and that is the importance of engaging leaders, both clinical and administrative leaders, needing to be on site for change to happen. Ultimately, those folks influence whether or not something does happen. If you have leaders, both clinical leaders, as part of your change process and part of that sustainability process, as well as from the top direction, it's going to be more likely to make your change successful. And questions that you can ask yourself about your project as you go forward is who is it that needs to be on site for this to happen? Who is it that needs to be engaged in order for it to continue to happen and to influence their colleagues and their peers? And for the organization's leadership team actively engaged in the QI initiative. And so you can just check for yourself and check for your project, and are other folks that maybe should be engaged that haven't been, or that you still could involve in order to help make your project successful long term. Next slide. And the other theme that we speak of so frequently is involving folks from the front line all the way through, and hearing of the projects today. I don't think there's any project that said, we didn't involve frontline people. It was all management driven. But again, you can ask and check with your team. Were frontline folks involved throughout the QI project? And are they still involved? And are there folks who maybe should be involved at this game who aren't? Next slide. And so when we think about the change ideas that we hope are going to sustain, we often want to aim for that zone right there. And I was joking with Laura I believe it was called the unicorn zone. We don't want to be adding workload, and we don't want to be doing something that has very little value. So what you really don't want to be doing is aiming for that red area on the right, where a change idea, something that we try in our project, actually increases people's workload and has very little perceived value for those that are doing it. That's very unlikely to allow us to sustain. We want to try to aim for that area of at least, if we can't reduce workload, let's not add to it, at least keep it the same, but try to reduce workload. And maybe that's by way of redundancies or rework or multiple steps in a process. But trying to reduce that workload and also aiming for an area that has high perceived value so that we all feel that this project or this change idea has value for us, for our clients, and there's that shared sense of ownership. And that's where we try and land with our change ideas. And hearing from the teams today, it sounds like that's certainly the case, but something to consider all the way through our project. Next slide. I should mention in that previous slide, you don't have to click back to it, but there's a lot more on this by Chris Hayes, who's out of St. Michael's in Hospital and an IHI fellow. And I would encourage you, if you're interested in sustainability and engaging teams in quality improvement, you can Google his name. There's some great stuff there. A little bit of a tangerine. It's also important as we want to sustain our QI work to make sure that we communicate the benefits of the process that were improved. And this is one of the reasons why we talk about finding those root causes and making sure that we have change ideas that address those root causes so that folks can understand the value. And if we have clear root causes that are leading to our problem, this is why we're trying some change ideas to address them. There's that clear linkage. It's easy for folks to see and to see the benefits. And a driver diagram can be a great way to illustrate that. If I'm working on one change idea, it can help to link it back to the larger aim of my project and perhaps the agency. And again, relating it back to that vision, organizational strategic plan and goals can be very, very helpful in sustaining momentum of the project. Next slide. And so it's also very important to ensure that change is ready to be implemented and sustained. We've talked a lot about PDSA cycles, and the last thing that we want to do is for folks to rush through with their E-QIP project to try and get to a place of implementation or sustainability of a change idea without going through in a very thoughtful way those PDSA cycles. We want to start small, and we always encourage teams start small. You know, if it's one clinician, one location, one day, trying our change ideas, gradually expanding out from there, maybe piloting it in another location, another day, another team, before we go to full implementation. We want to have data from those PDSA cycles telling us that the changes that we've tried are in fact an improvement, and we're confident in that. We're not just hoping it's going to be, but we're confident in that because of our PDSA cycles. We want to be doing that before we try and sustain. We can ask ourselves, is the change perceived as an additional duty or task? And if yes, improvement is unlikely to be integrated into the organization's culture or become the way we've always done things. Next slide. We also want to make sure we try and embed that improved process. So make it as easy as possible for folks to follow that new process. You know, there's examples of forced functions within some client information systems. If, for example, we want someone to complete a new tool, maybe it's completing a full OCAN. There's some programs where you can't save your notes or save the partial OCAN until you've completed those mandatory areas. So by embedding that process, sort of hardwiring it, we make it easier for folks to do the new process and to do it correctly. And some questions you can ask for yourself and then looking at your project is the goal of the implementation project and its sustainability linked to the strategy or vision of the organization? Is it embedded in there in our strategy? Is the improvement change well integrated into the culture of core practices of the processes of the practice? Is the improvement change flexible and able to respond to changes in environment? Is it going to hold up if our environment changes slightly? Is it embedded enough that we'll actually be able to maintain? Next slide. So some suggestions that you may want to take a look at around communicating about change ideas. So if we're trying to encourage a change idea to be used or to be followed, we want to make that communication as easy as possible for people to pick up and see and follow the change. So some of the suggestions is from the 5 C's. We like these acronyms in QI. 5W2H, 5 C's, all of these kind of fun things. So the first one is making it conspicuous. So if we're doing a change, let's have it visible, have it easily catching folks' eyes, posted, brightly so that people can see that change and hopefully pay attention to it. Contiguous, so in the time and space where it is necessary for the action. So there's no point if we're asking folks to follow a new process to post information about that new process at a different location or at not at their workstations perhaps, but somewhere that they're not going to see it. We want to make that as visible in the space and time where it's needed as possible. So if I'm following that new process, the new instructions, the new documents, whatever it is going to be where I need it, when I need it. And that leads to the next one, which is context. So providing that information where the new process should be followed, making sure that we have guidelines, instructions, everything within that context and adapted to the local context. Fourth is content. So provides enough information about what should be done, but it's also concise. We don't want to overload people with information and details about a new process, but rather give them what it is that they need to know, when and where they need to know it in a concise and easy to follow way. And lastly, count. So identifies the number of actions needed and should limit decisions and choices, keeping it simple. And keeping it simple is very important, I think, as we try to hardwire and communicate our change ideas. Next slide. That is to build in ongoing measurement. So we want to not take our eye off the ball. We want to continue to measure what it is that we've changed. And maybe it's not going to be as frequently or it's not as detailed. If we're confident that our process measures have done their job, our change ideas are embedded, but keeping an eye perhaps on that outcome measure longer term to see if it actually does continue and become part of the standard way of practice, if that change does hold, but continuing to measure over the long term so that we don't lose gains and then look back in a couple of years and say, oh shoot, things have actually reverted back to the way they were. But continuing to measure all along. Next slide. So lastly, talk a little bit about some of the ways that we can hardwire changes in and some of the tips for that. So we've talked about it, but testing in a variety of conditions is important. Not just going straight to implementation, but testing under a variety of conditions. And the majority of staff have been part of that tested change and had opportunities to provide feedback. Improvements in key processes and outcomes are clearly evident on run charts or control charts. So we really want to make sure that if we're going to sustain something, that we do have that data to back it up and that it's clear. We've seen significant movement in our data. All staff on all shifts have been trained and thought given regarding training for new temporary staff. Again, if we're changing something, we've given folks the opportunity to have that training be fully informed, part of that process, and we have an ongoing built-in training mechanism for future. And that necessary supplies and equipment or new forms, whatever it is that we've changed, are in place. People don't have to search for them. They're easy, accessible, and everything's ready to go. Next. Oops. That we have a small set of measures have been identified to monitor performance over time, and individuals have been assigned responsibility for monitoring performance, and that there is a plan for communicating results to senior leaders. That speaks to that importance of continuing to keep our eye on that measurement ball and be cognizant of our measurement long term so that things don't start to slip. If performance does decline, accountabilities have been identified to address the situation. So setting up a plan, who's going to be accountable? What are we going to do if we do start to see things slip? And what is our threshold to know if we start to see our movement in our data points? Do we want to say, 2 months minimum, we see a decline, 3 months minimum, we see a decline, and then we take action? What is it that's going to trigger us to start to take action if we do see a decline? And that standard work has been developed and documented. So just some of the tips around sustainability, and I'll hand it over to Deb now, I think, to walk through the NHS Sustainability Planner.
Yeah, so this is a really lovely tool from the UK that is very useful for looking at your projects, both at the beginning, in the middle, and as you begin to make some changes. So we'll see if we can bring it up in just a second and show you it live. So it is very helpful to do, and it doesn't always make sense in our minds to do sustainability when we're beginning our project, but there are some areas here where it speaks about infrastructure and who's involved, and if you can think about those things up front, you're more likely to have a project that is going to be sustainable. There may be some things you need to plan for that it would be best if you did that when you started the project as opposed to at the end. Certainly in the initial pilot testing, when you're starting to try some of your change ideas, and then after you've done some of your improvements to ensure that it's holding the way you're expecting it to. So this is the tool, and there's sort of 3 categories for it. So there's an organizational, a staff, and a process questions that you respond to. So they have a standard score that if you get 100%, you would have this color on the graph that they're going to produce for us. And then there's also how you would score yourself. And it helps us to identify the areas that we could spend some more time working on. So there's a piece around infrastructure, and it's fit with the organization's strategic aims. It's always helpful to have your project aligned with organizational aims, or otherwise it's probably not going to continue to go. The staff, both the clinical and the administrative teams, frontline as well as senior leaders, are they all involved in understanding and making a commitment towards sustaining or keeping the changes going? And then the processes that look at the adaptability of improved processes, the benefits beyond just helping the client. Is there some benefit for the organization as well? And I think with each of the projects that we heard about today, there is some benefit by working through. It benefits the client, but there's also the spin-off that it benefits the organization as well. And is the evidence credible? And how effective is the system in being able to continue to monitor this? So if every time you need to find out whether or not you're still on track with this, you've got to do a manual piece of work that takes 10 hours to pull together, you can guess that that's probably not going to be looked at very often. So this is what the tool looks like. And you can see there's the 3 different areas. So the process is in green, the staff is in a fuchsia, and the organization is in a teal blue or perhaps a turquoise. It doesn't come up quite so nicely on the one that we do, but this is really pretty. So assume that this is how it's going to look. So I'll see if I can pull that up for you, but I just want to talk a little bit about how it's used and the reason why it's a helpful guide. And so all of these words have relevance to the tool, but it helps us to look at our high scores and our low scores. So where we have our strengths and where we ought to spend a bit more time thinking about how to improve that. It's very practical. and it gives you ideas on things that you can try. It's a picture, which is lovely, and it's not quite as pretty as those three colors, but it is a picture that you can look at. It's inclusive, and meaning that everyone gets a chance to complete the sustainability guide, and then you blend all those scores together. It's very doable. And it has suggestions for how to simplify it. There's different approaches that you can use, so it's balanced. It's tailored to a variety of different audiences, whether it's clients, whether it's frontline staff, whether it's senior leaders. It's forward-thinking in that it wants you to connect with a strategic plan, which is always beneficial to do. Fits with the whole organization, and they're real-life examples of things that you can actually do. So the guide not only has a scoring tool, but also has some suggestions on how you can improve. So this is what it looks like, and just one second, I'm going to try to pull it up. Maybe I'll do that first, see if I can pull it up for us. Bear with me, I'm hoping I don't kick us off. So 1 Mississippi, 2 Mississippi. So far looking good. Everyone's got their fingers crossed out there in Cyberland. Okay, so here we go. I think you already have a tab. There we go. I think it's this one. Huh, I am on the internet. Let's go back here. All right, well, maybe I'll go back to the slides, and I'll show you from there. So when you're at home, you could try this, not be worried about cutting off, 11 or 12 other people. But this is one of the reports that you would get. So there's a series of questions on each of these categories. So there's some infrastructure for sustainability, specifically asking you about what you have in place at your organization. The clinical leadership engagement, which you can see in this particular example, there's a big difference between the blue bar, which is the agency's results, and the maximum score that you can get. So it invites you to choose 2, 3 at the max areas that you might want to focus on. And if you look at this, clinical leadership engagement and senior leadership engagement, there's big differences between the survey organizational score and the perfect score, or the maximum score that you could get. So they probably don't have to spend time on staff behavior towards sustaining the change, because they've done really well on that category, and on the very bottom, very well on benefits beyond helping the client. So this has benefits for the organization as well. However, they don't seem to have the clinical or the senior leadership involved in the same way they could, and I can bet that might cause some difficulties with trying to sustain this. So it also gives you this lovely score at the end, and if your overall score is below 45, then you might want to spend some time figuring out how to make that better. If your score is over 55, then yay you, pat on the back, and you're doing really, really well. And if your score is below 35, it often suggests that maybe this is not a project that you want to continue to hold on to or sustain. It's not seeming to fit with what it is your organization is all about. So again, 2 to 3 factors to work on, and then to rescore it in about 6 or 8 weeks and have a look at what your scores come out at that time. So I already mentioned that it would be helpful with our scoring here, it would be helpful to have a look at the clinical leadership engagement and the senior leadership engagement. And in the guide, they have some suggestions on how you might do that. Your team also can probably generate a number of ways of doing that, whether it's lassoing somebody and making them sit in the chair till they agree to do all of this stuff, or whether it's something more practical where they can be involved in listening to what clients say about the service. So thinking about ways that you can get people involved. Okay, and then the last area that we want to spend a little bit of time on before I hand it to Jenna to talk about how you can stay involved is that important part about spread. So you have done some outstanding work, and there's somebody else who needs to know this. So if you can think about it in that way, we can keep our secrets and we cannot tell anybody, But there's some brag rights here, and some outstanding work that's been done, and there will be another organization or 10 that could benefit from what it is you've learned and sharing that. So thinking about how best to do that. So when we think about that whole process of getting to the place of spread, you've developed a change, you've tested that change, you've implemented something with your Plan, Do, Study, Act. Plan, Do, Study, Act, yes. Sorry, I'm a little foggy here. And so it's become part of your routine operation, and you've put in place ways of holding that gain, so making sure that you continue to do that same activity every time. And then there's time to think about who else would benefit from doing this. Sometimes it's your own organization. It's a different office. It's a different place a different part of your program that would benefit. But other times it's someone else in community or another organization. So HQO, Health Quality Ontario, has developed a lovely tool, a spread planner, and has sort of 4 areas for spread. And so you can get this from the community of practice as well. Open it up. It's about 5 pages and helps you to really think about what is it that you want to spread. So what was the lesson that you learned, or what is it you're doing differently that others would like to know about? Figure out how you're going to do that. So I'm going to go to Hawaii and present at a conference over there because I think that would be important for them to know. Someone else might decide they want to go to St. Catharines or Sault Ste. Marie to present. So thinking about how you're going to do that spread. Is it a conference? Is it a community practice? Is it a sharing with a like-minded group of people that you might get together with, a couple times a year? Identify and confirm the resources that you're going to need to do that. So if I'm going to Hawaii, I'm going to need a ticket and my bag packed and a conference to go to. But all joking aside, that think about what resources you would need in order to do that spread, and then monitor and communicate your process. So what's the key messages that you want to get out there to people, and how best are you to deliver those? So sometimes that's a social media piece, sometimes that's a community of practice, sometimes it is presenting at a conference of like-minded or people who do relevant work, and then being available to chat with people about your learning, and that way we can spread some of the great work that you have been doing. So that sort of ends where we are. If you're at spread, then you have completed the model for improvement, and that's where we're hoping all of you will get to. And I'm just going to pass this over to Jenna to talk about how we stay involved.
Okay. So most of you have seen this slide before, but it's really all about, and Debbie's started this conversation, but how we can share what we've shared today with each other, with others that might benefit from hearing from you. And just kind of a caveat to this, I know that we've been having a lot of conversations with the E-QIP team and our coaches, and something that we're noticing that's coming up is we've done 3 cohorts of projects now, and we're often working with agencies that are working on very similar quality issues. So, dropout rates, wait times, client experience, it's all very common. So it's just important for us to let you know that, so that you really understand that what you're doing is incredibly valuable, not only to the clients that you're serving, but sharing what you're doing can often inspire and give people kind of sparks of motivation to make service better for their clients as well. So I just wanted to open with that because I think it's worth sharing, and I think the E-QIP team would echo that that sentiment. I also wanted to point out that the slides I'm going to go through are, they have a lot of hyperlinks in them to additional resources and ways that you can stay connected with the E-QIP team. So if you go to the handout section of your GoToWebinar window, you'll see the slide deck, and I encourage you to download that so that you can take advantage of the hyperlinks that I'll be going over with you. So this slide is really just all about the value of sharing your work, and that lack of spread that we have chatted about over the last 45 minutes or so is really, where there's good things happening in QI work in our sector, there's often not that spread and scale of that good work. So all of what you're going to be hearing from me is trying to give you the tools and confidence to share what you're doing with others. So the first thing that we were trying to do, and as an E-QIP team, we're trying to enhance is our online presence. And one way that we're doing that is on Twitter. So there is a hyperlink on this slide that if you click on, you'll see all of the tweets related to our hashtag E-QIPON. And we encourage you to follow that hashtag because that's where a lot of our most up-to-date information will be, and you'll be able to stay informed about where the E-QIP team is and some exciting work that we're doing within the field. If you have a Twitter account or your organizations, and I know all of you on the phone, your organizations do have Twitter accounts. If they're tweeting, we encourage you to share your work through your organizational account and use the hashtag E-QIPON so that we can have that nice thread of the work that we're doing and supporting throughout the sector. So I just wanted to flag that for you. You know, if you have a personal account, you're obviously more than welcome to share the work that you're doing on there as well. But we do try and include organizational handles on Twitter in our tweets, and that's something that we're trying to grow online. Another way that we're going to work with you over the coming months to share your work, and hopefully this won't be a lot of work on your part, is to create a project profile for the projects that you've all just talked about. We did this last year with our Cohort 1 projects, and they're really useful in getting out the messaging and sharing experiences of the QI work happening within community mental health and addictions in Ontario. And so there is a hyperlink there where you can see all of the PDF files from our Cohort 1 project so that you can get a sense of what we'll be asking or what we'll be writing about your projects about. A lot of the information that you've shared today will actually provide the content for those profiles. And how this is going to work is the E-QIP team will actually write the profile for you, and then we'll just ask you to read it to make sure that we've captured the information correctly. And then we'll be able to use those PDFs of your project profile on our website. You're more than welcome to share it on your organization's website and use as an information sharing tool. I know a lot of you talked about, you know, sharing your project with your staff and community partners, so it's a really good tool for you to have to use that way. And we'll hopefully get those completed within the next couple months. And again, all that's required of you is to make sure that what we've written is accurate. And then you can use that profile as you wish. Something else that we've been working on over the last couple months with our communications committee, and I know Valerie, you're on the line, and Azad, another QI lead, is part of that work, is coming up with some themes from September until the end of the project in March, where we'll be focusing on our communications. So our newsletters, our community of practice, our tweeting, our webinars will be focusing on these topics. And these are topics that we feel are really important to the sector based on our experience working with you as well as what we're hearing from the teams. So I won't go through all of them, but I just wanted to kind of flag you know, where you might see yourself in some of these topics so that you can share your stories through our various communications channels, and we will work with you to do that. And so, you know, there's the topic of client and family member engagement is a really popular one in our sector, and you know, tips and techniques that you've used in your work. So, you know, Fred Victor has done a lot of work in that area. You might want to consider how you might want to share your story with others. The whole topic of collaboration and quality improvement is also something worth sharing and really focusing in on, both across organizations, but also as a QI project team. You know, Collingwood, your work with your community partners might be something that we could highlight there. Wood Green, I know that your work is really focused on improving client outcomes and making sure that your clients are getting the care that they need, and I think that would fit really nicely into the quadruple aim for quality improvement in terms of how we're making services better for clients. And from Addictions Services in Thames Valley, you know, we heard from you, one of your key lessons learned was trusting the process, and I think that's the language that you actually use. So you might want to consider sharing your work through the months on that topic specifically in terms of trusting the model for improvement and really getting to the root cause of something and starting small as you're starting to test or change ideas. So these are just some opportunities for you to think about, and you know, I just gave some ideas, but you might have others that you know, other things that you're really keen on sharing with other organizations, and that's great, and we're open to that. But these are just some ways that you can share. So we often write newsletter stories. We have a communications consultant that writes really nice stories about QI work happening in the field. You can write a community of practice post. or we can write one for you. Our monthly webinar series, we really like to have panelists from within the field doing QI work. So if you or your team members are really keen to talk to one of those topics, we'd love to have you as a panelist on the webinar. And, you know, again, sharing through social media using our hashtag is another opportunity for you to share your work. And, you know, I encourage you to think about those themes as you're doing that. So our theme for September was leadership, if you noticed on the slide before. So we started a new discussion forum thread on that topic. And the question is hopefully fairly straightforward and open for you to interpret as you wish. But we're really asking you to write some of the actions and approaches that the leaders in your organization have taken to really help you do your quality improvement project well. And we've heard about some of those stories today. So you know, we heard about leaders that have enabled you to have resources and time to be able to do your project, and also the value of having a good, strong QI team lead to drive quality improvement work forward. So it doesn't have to be a long post, you know, but we do encourage you to write a line or two about, you know, what are some really specific tactics that have helped you from a leadership perspective move your QI work forward. And these are just some tips for using Quorum in our community of practice. You've seen this slide before, but I just wanted to reiterate these 3 tips for using Quorum in our community of practice because they're really helpful. The first one is to subscribe to updates, and there is a handout in your handout section that will let you know how to do that. You can also set your push function so that you actually get an email to notify you of any updates on our community of practice. And also I encourage you to use the search function in our attachment area where all of the QI resources that you've been given as part of your coaching curriculum, as well as many others, are posted. The search function works really well on the attachment section. So if you're looking for a fishbone, for example, you just type in fishbone template and that will come up for you. We're also trying to pull together a webinar on leadership for quality improvement on that topic. And really my ask here is for anyone that's been part of a project that has had a really strong executive sponsor that has really enabled you to do quality improvement and given you the tools and you know, freedoms and support that you need to do your QI work. If anyone comes to mind, we'd love to have them as a panelist on a webinar. We try not to make that process too onerous on you. It's usually a few questions that we ask our panelists to answer. There's usually no kind of slide deck or PowerPoint that we request from you. It's more about having a conversation and getting those practical strategies and approaches out to other people that might be able to benefit. We're also, I'm going to do one more webinar for just the Cohort 2 agencies, and this one will be on the role of data in the PDSA cycle. And the reason for this is that we want to make sure that you have a solid understanding and knowledge of how to do PDSA cycles well, and have the data to support you to understand, you know, if you should carry on with that change idea after a PDSA cycle has been completed. And I know a lot of teams on this call are well versed in that, but we just want to make sure that you have another touch point with us to make sure that your PDSAs are progressing and you're able to test multiple change ideas and understand how data can play into the decision making that often, or that does come after a PDSA cycle has been completed. So we have had one team volunteer to share an example of a PDSA cycle that they've been working on from Nipissing. They presented this morning. We are looking for one additional team to share their experience with PDSA cycles and share a PDSA worksheet if it's mostly completed. So I know a lot of you are, you're often scared to share your experiences, but I think they're so rich based on what we've heard this afternoon. So if any of you are willing to share, that would be really great. What would be expected and asked of you would probably be a 5 to 10 minute overview of what your PDSA cycle looked like. And then you would engage with our coaches on some conversation about what might be some next steps for that change idea. So it looks like the date for that will be October 10th. And if you're not presenting, we are inviting all Cohort 2 agencies to come to that. So just keep the lunch hour on October 10th open for that. No, it's the week of the 7th.
Oh, the week of the 7th,
Yeah.
pardon me.
So it's the week of the 7th, but we're narrowing in on October 10th right now. So just keep that lunch hour free for that webinar. And even if you're not presenting, we're hoping that that webinar will be useful to you. Another way for you to share your experience that will really help the E-QIP team in the future is to participate in E-QIP or evaluation. So over the winter, we're hoping to contact all of the QI leads of the projects that we've worked with in this cohort to help evaluate how the program has been working for you and how you experienced the coaching support that you received. And really it helps us understand the impact that it has had on yourself as a QI team lead and someone that's an emerging or an already leader of quality improvement in your organization. It'll also help us understand the impact that we've had on your organization. It'll help us learn how we can improve our coaching service for future cohorts and work of E-QIP. And also to continue to understand what your QI capacity needs are as an organization. So keep that in mind, that we'll be contacting you about that over the winter. We just wanted to flag that for you today so that you know to expect it. And we also encourage you to sign up for Health Quality Ontario's annual conference, Health Quality Transformation, as well as the Quality Improvement Patient Safety Forum. There are two, one of the Patient Safety Forum is on October 16th, and Health Quality Transformation is the following day on October 17th. And that conference actually has several different locations across the province. So it's not Toronto-centric. There's different satellite locations for that day. So there is a link on this slide. I encourage you to go there. Sign up is free, and we're really hoping to have good representation from the sector at both of those events. I'll just flag that at Health Quality Transformation, so the day on October 17th is the larger event, and it's open to everyone in the healthcare sector. We do have 3 of our projects from Cohort 1 that will either have a poster or oral presentation that day, and they're listed on that slide. So these are just some actions for you to consider as you move forward, and we'll send out an email on Friday after we've done both of the report back sessions. So all of this information will be in that email. Some actions for you to think about are once your project profile is ready, in the next month or 2, we'll be asking you to review that. So just to expect that in your inbox at some point over September, October, November. Add your post to our community of practice on helpful actions of QI leaders within your organization. We're defining leadership quite broadly, so think about things that your executive sponsor or QI team lead has done that has enabled a project to work. And if you are a QI team lead, think about some things that might have helped you as a leader do your role well as pushing your project forward. Also, let us know about an executive sponsor that we might want to highlight in our upcoming webinar, and we can reach out to them and ask if they'd be interested. Sign up for the PDSA webinar on October 10th. We'll get that registration information out soon, and also let us know if you'd be willing to share in that webinar. Review those monthly topics and think about if there's anything that you'd like to share through our various communications channels, and we'll work with you to either write up a story or a post or get you involved in a webinar on a topic that you're really passionate about discussing with others. Look for the evaluation email again over the winter, where we'll ask you to participate in a survey or potentially a key informant interview, and register for Health Quality Transformation. And these are some resources that kind of tie into what we've talked about today on sustainability and spread. I won't go through all of them, but I'll flag this third bullet for you. We, as in the E-QIP team and our coaches, have developed an online series series of webinars that are about 20 to 30 minutes long each, on all of the different tools that we've gone through with you as a team to use the model for improvement. So there's for a refresher on all the tools that we've gone through with you, there's a webinar series to help you do that. And we use a case example from the sector to demonstrate the tools. So if you need a refresher yourself or folks on your team, there's a nice webinar series online for you now to do that. Okay. And this is our contact information. Mike, Debbie, or myself are more than willing to talk about quality improvement any day. We love to hear from our teams and support you as we can. So our contact information is all there. And I'll just pass things back over to Mike or Debbie if they have any closing remarks from today.
It's Mike. I guess I can start and just say, a huge thank you to all of the teams who participated today. I know it's been a pretty incredible journey, a lot of work, but hopefully this has been a helpful experience, and it's certainly inspiring for us to see and hear about this work, because it really does, you're on the ground floor of quality improvement for our sector. You're really leading the way, and this work means a lot, I think, in how we tackle quality care together. It has some pretty big impacts. So thank you so much, and fantastic work.
Yeah, it's Debbie. I would echo that. It's many of these projects, I remember sitting in a room and thinking about, what their focus was and where they're going from here, and imagining what it might look like when we got to this point in time. And you really have exceeded many of my thoughts, and the learning that you've had along the way has been outstanding. I hope that you will take the chance to talk about what you've learned, and perhaps even to brag about what it is you've learned, because you are a unique set of people with a unique set of knowledge and experiences, and others could really benefit from that. We do have one more day of report backs. We would invite you to please join if you can. You can sort of not stay for the sustainability slides again. You've heard those already, but we are starting at 8:45 on Thursday morning, and again at 12:45 on Thursday afternoon. The rest of the teams will also be presenting, so happy to have you join us with that. And if you don't have the the webinar link, let us know. We'll be happy to send that along. So thank you, everyone, for all of your work, and I hope you're feeling really good about what you've accomplished, because it is very exciting. Any last comments or questions?
And he said something about
I'm just opening up the lines if anybody wants to say it out loud. Any last comments? No? Well, then thank you, everyone, for joining.
Thank you.
Yeah, thank you, everybody.
Thanks, guys.